In this part, I will explain you how to end a visit in ERKReg. On the slide, you can see the patient list overview in ERKReg. All patients registered at your center are listed here. When you click on a patient, all available functions for adding or changing patient information will be displayed. The basic data section was already covered in part 5, where we explained how to enroll the patient from the beginning. In this part of the training series, we will focus on entering the first visit. To enter the initial visit, you can either click in the comment section on Click to enter initial visit, or you can click on Add visit below the patient information. All visits that have already been entered will be shown under the tab Previous Visits. This allows you to go back at any time to review or edit a visit and add further information or correct data if you notice that something was entered incorrectly. What do we consider as the initial visit in ERKReg, and when do you start entering patients in ERKReg? ERKReg is considered to be a prospective registry. So in general, we consider the date of signed informed consent as the starting point for the patient's participation in ERKReg. It is important to note that ERKReg can include both incident and prevalent patients. This means that patients do not need to be newly diagnosed in order to be entered into ERKReg. Patients who were diagnosed several years ago or who have already been followed at your center for many years can also be included as soon as they have signed the informed consent. For the initial visit, you should select the visit date close to the informed consent date. As a general rule, this can be a visit up to 6 weeks before or any visit after the signed informed consent. For some sub-registries, retrospective data may also be collected. However, this will be explained in more detail in the sub-registry specific part of our training series. Here you can see the first question that needs to be answered when entering a visit, which is the visit date. The visit date is the date on which the patient was seen at your center for a clinical checkup. Once you enter the visit date, the patient's age at the time of the visit is calculated automatically. If no visit information is available, for example because the patient only had a phone call or was not seen at your center during the past year, please select Data Not Available. This shows that you are aware of the annual visit updates, but that you are not able to provide clinical visit data for this year. Please note that the visits marked as Data Not Available are not eligible for reimbursement. And in addition, if no visit data is available for 5 consecutive years, we may ask you to terminate the patient in ERKReg, as this indicates that the patient may not longer be followed at your hospital. The next important item is the current treatment modality. Here you can choose between conservative treatment, hemodialysis, peritoneal dialysis, and transplantation. Please select conservative if the patient is not currently receiving kidney replacement therapy. This means that the patient is not on dialysis and has not received the functioning kidney transplant. As shown in the diagram, a patient on conservative treatment can either progress to dialysis or directly to transplantation. From dialysis, a patient can either go back to conservative treatment if the clinical situation improves, or the patient can move on to transplantation. If a patient has received a kidney transplant, the treatment modality should remain transplantation as long as the transplanted kidney is functioning and the patient does not require dialysis. Here you can see that we do not request many details for the clinical visit in ERKReg. After selecting the treatment modality, you will be asked to enter data such as height, weight, blood pressure. You will also be asked to enter biochemical data, especially the serum creatinine. This value is very important because it is used to estimate a GFR, which reflects the patient kidney function. Therefore, serum creatinine is essential to understand the patient kidney's function and CKD status. The following questions related to quality and performance indicators are depending on the patient's diagnosis and on other information that have already been entered. They are mainly used to assess whether a patient had a relapse, whether treatment follows current recommendation, or whether certain medications were given. Please complete all requested information as accurate as possible. Now we will discuss what you do if you do not have one of the requested values. There are several options. First, please check whether value is available close to the visit date. For example, if blood samples were not taken exactly on the date of the visit, but were taken 2 weeks before, it is completely acceptable to use the values. As a general recommendation, values can be used if they were obtained within a reasonable time period around the visit date. So, for example, up to 2 months before or after the visit. If several measurements are available close to the visit date, you may also use a mean value of all values. This is particularly useful for blood pressure values, but it can also be applied to other repeated measurements where appropriate. If the value is not available at all, we recommend adding a note to the medical file. This helps ensure that the next treating physician is aware that the value should be requested or measured at the next visit. And this can also help your center establishing a routine for collecting the relevant values for rare disease patients. Please note that the values requested in ERKReg are considered important for good clinical care and are also linked to our quality and performance indicators. Especially height, weight, and serum creatinine are important. These values are used for further calculations such as BMI or CKD status. They are also important for later analysis of patient data. Therefore, if these values are missing, please make a note to collect them in future visits. If you do not know a value and the field is not mandatory, please leave the field empty or select unknown if this option is available. We noticed that some centers enter dummy values for mandatory fields, which is not recommended at all. However, if you do, please inform the ERKReg central office so that we are aware of it and can delete them before analyzing the data. What happens if you have the value but it's not available in the correct unit? In this case, you can use the converter provided on the ERKReg platform. The converter is available next to the respective value field. It automatically converts the value and saves it in the correct unit. If no converter is available for the unit you need, please inform the ERKReg team. We can then check whether this converter can be implemented on the platform. In the meantime, you may use a reliable online converter before entering the value into ERKReg. What happened if you want to save a visit and this was not successful? One possible reason is that ERKReg is very modular. To reduce the time needed for data entry, we only ask questions that are relevant for the individual patient and the individual situation. This means that additional questions may appear depending on information that has already been entered. For example, additional questions may appear depending on the patient's diagnosis or if the patient has a CKD status above 3. Therefore, if saving was not successful, please check whether new or additional questions have appeared and complete all remaining required fields. Usually, the missing fields are highlighted with warnings. Once all relevant questions have been completed, you can save the visit again. Now we can see an example related to dialysis. If you select, for example, peritoneal dialysis at the beginning of the visit entry, additional dialysis-related questions will appear. For example, you may be asked when the dialysis treatment started and whether there was any other treatment in between. Let's assume that you choose peritoneal dialysis, but the patient previously received hemodialysis. In this case, you can indicate the previous hemodialysis treatment in the respective field here. There may also be quality and performance indicators related to the selected treatment modality. Please make sure to complete these questions as well. Here we see an example related to the CKD status. As mentioned before, some blood parameters and other values depend on the CKD status of a patient. If the patient has a CKD status above 3, additional questions will appear after trying to save the patient's visit. Please complete these additional questions to ensure that all relevant clinical information is collected and that the visit can be saved correctly. As soon as you saved and return to the patient list, you can see the visit listed in the previous visits. The system shows you when the next visit is due. If the field is green, your patient is up to date. If the comment is yellow, next visit is due soon, and if it's red, the visit is overdue. Now you are ready to enter visit data in ERKReg. Let's continue with how to enter medication, adverse events, hospitalization in our next chapter of our training series.